Hey everyone, ET here, and welcome back to WYSTEM. I'm really excited to kick off Science Week. And we've got some really cool people joining us this week to talk about science, viruses, and bacteria. So I think you guys are going to really enjoy the content that we have for you tonight, and also for part two on Thursday, which will also be at 6 p.m. So I want to kind of remind you again, this is a celebration of the STEM fields, and STEM stands for science, technology, engineering, and mathematics. And we've got some amazing people around the state of Wyoming who are going to teach you all kinds of things like viruses and hand washing and 3D printing and coding and 3D sculpting. So we're really excited. I just want to again thank everyone at the WTCC Anderson Elementary PTO for making this video happen. So, and also as a reminder, one of the cool things that we're able to do with this event is either tonight or tomorrow, I'm going to post like a little secret code word over here on your screen. It might be tonight, it might be tomorrow, you don't know. And if you catch all 4 words over the next 4 weeks, you'll have the opportunity to enter into a drawing to win your school a 3D printer, and then you can then use that. So how cool is that? So we are just super excited to be able to offer this to everyone who is watching right now on YouTube Live. So thank you for joining us. And I guess now that really kind of segues into Science Week celebration, part one of two. We have Dr. Dan and Amy Surdam. They own the Stitches Acute Care Centers, and they are on the front lines of COVID-19, and they're professionals, and they are really excited to be here with us tonight to teach you some things about viruses and all these things. So I'm going to go ahead and hand it right off to Amy and Dan Surdam. So Amy and Dan, thank you so much for coming.
ET, thanks for having us. It's a real pleasure.
Yeah, hi everyone. Hi boys and girls. Hi Elena, Lucy, and Ben.
And first of all, we'd just like to say happy Cinco de Mayo.
Yes.
Super excited to be here on this day and talk to all you STEMmies out there. We feel it's a huge honor and a privilege to tell you a little bit about our profession and how that fits in with STEM, specifically with the sciences, but it really does incorporate the whole kind of ethos of what STEM really is. So my name is Dr. Dan Surdam, and I'm a physician. I grew up and born and raised in Laramie, Wyoming. I went to prep for my elementary school and junior high, and went to Laramie High School, and then went on to college in Colorado and went to medical school 4 more years after college in Omaha, Nebraska. And that's how I became a doctor. And then Amy's going to tell you a little bit about herself.
You went to a lot of school.
It took a long time. It took a long time.
So I'm Amy, and I'm a family nurse practitioner, and I went to Baggs Elementary, then Cary Junior High, and then East High School here in Cheyenne, and then the University of Wyoming for my undergraduate degree, where I became a registered nurse. And after I was a nurse in the emergency room for quite a few years, I went back to school and got my family nurse practitioner degree from the University of Wyoming again. And what that means as a family nurse practitioner is I'm able to actually see patients independently and diagnose and treat, prescribe medications for patients, and help them come up with a plan of care afterwards. It's a wonderful profession.
And similar to nurse practitioners, what physicians do, we really focus on medicine in terms of there's a huge focus on preventing illnesses or when people get sick. But after they do get sick, why I went into medicine, and because I loved science and I loved helping people, so I thought it was a really good fit. And today we're filming live from our clinic here in Cheyenne, Wyoming at Stitches. And it's a healthcare clinic where people come when they're not feeling well, or sometimes when they're feeling well, but just want to talk about health and wellness or other preventative things. And I think you guys have probably all heard about the coronavirus. And so we really wanted to try to talk about something that's relevant to you guys. And well, one, wanted to encourage all you guys to go into the field of medicine, because we need super bright, energetic people to come help us out to make the world a healthy and safe place to live. And so that hopefully we can encourage you guys through some of these discussions that we're going to have tonight to go into medicine. But also, we really wanted to talk about the coronavirus and what's going on with that, and kind of define some terms and discuss what a virus is and kind of what we can do to keep ourselves safe and healthy. Because you guys, I'm sure, have been hearing a ton about this on the news and talking about it with your family.
And they're not in school.
That's true.
Yeah, so you're at home, social distancing, and you all know what it means now to not be playing with your friends. And so we kind of wanted to talk about why that's important and why you're going through that right now.
And so just some basic terms that I want to cover during this discussion. ET is going to kind of show what we call the terms and germs. And basically, these are just some main ideas that I want to make sure that we cover over the course of this discussion to give you guys a better understanding of maybe what's going on. So we're going to talk about things like bacteria, viruses, what virology is, what genetic material is, microorganisms, what the scientific method is, and then lastly, kind of talk about outbreaks, epidemics, and pandemics and what the difference is.
You said PPE, not PP, right?
Ooh, no. Hold your PP. We're going to talk about PPE.
Okay.
So we're going to get to what basically what all this coronavirus really boils down to is germs.
Ew.
Yeah, we used to call it cooties, but later on when I went to doctor school, I found out that's not really the right term for it. So it's germs, and we're going to kind of talk about what germs are. But before we talk about germs, I really want to talk about basically the basic building block of living organisms, and those are called cells. Amy, can you think of what maybe a good example of a cell is?
So a cell has proteins and RNA and DNA on the inside and a shell. So maybe an egg?
Yes. So an egg is a perfect example of what a cell really is. In fact, the largest known cell in the world is what? An
ostrich egg?
An ostrich egg. So that's an example of the largest cell. And so when you think about a cell, you have that picture in your mind where there's an outer membrane, which is the shell, and the yolk would be the inside, kind of the mechanics of the cell. But on a microscopic level, we think about humans, maybe your dogs or your cats or your plants at home are all composed of cells. And so what a germ is, germs are either one-celled organisms or multi-celled organisms, but they are microscopic organisms. And Amy, can you help me out what a microscopic organism is?
So I would think microscopic organisms are really, really tiny organisms that you can't see with just your eye. So smaller than even an ant crawling around. You'd have to use a microscope to see a microscopic organism.
Correct. So germs are microscopic organisms that we can't see. They're invisible to the human eye. And that's why they can cause so many problems. So there's really 4 types of germs that we want to talk about in medicine. The first type is a bacteria. And a bacteria is a single cell organism that basically has some of its own machinery inside of its shell or coat, but it requires energy from other sources. So it has to live together with other organisms. So either, for example, on our skin, or some bacteria live in our digestive tract, and they can really actually help us. They don't always make us sick. Bacteria can help with digestion and nutrition. And so, but the problem becomes when cells either overgrow or produce certain toxins, they make us really sick. So that's the first type of germ that we wanted to talk about.
And I think for you kids at home, if you've ever had strep throat, that's a bacteria. And maybe someone you know has pneumonia, and that can be bacterial as well.
Right. So, and typically when we talk about treating bacteria, we do have medicine for those infections, and we call those antibiotics. So that's the medicine that we typically use to treat bacterial infections. The second type of germ that we wanted to discuss with you guys is a virus. No, yeah, I mean, disgusting, right? Yeah. So these things are super, super microscopic. We can't see them. In fact, they're so small, they can float through the air, or they can live in our saliva or in droplets when we cough and sneeze. And they can live on surfaces for a long time. And so that's why it makes it so hard sometimes to keep ourselves healthy from these viruses.
I have a question about viruses.
Sure.
So you said with bacteria that they can be both good and bad.
Right.
Viruses can't be both good and bad, though. They're just bad, aren't they?
Well, it depends, right? So viruses are all around us. We breathe in viruses all the time because they're so small, but sometimes they can make us sick. We don't really understand, the origin of viruses or why they're around. We can, link them back to probably they had an important mechanism in evolution. But from our perspective in medicine, we typically think viruses are usually bad. And so they're microscopic and they have an outer coating, and then they've got some basically genetic material inside. And genetic material is basically molecules that help the cell or organism function. They tell the cell what to do. They're basically the blueprint of the cell, and they produce proteins and things that we need to help build bones and muscles. They affect the color of your eyes and the color of your skin. And so that's what the genetic material is really made of. And so that's what a virus is. And the difference between a virus and a bacteria can basically reproduce or grow by dividing itself in half. So it doesn't require any other assistance, but a virus has to attach to a host. So a virus has to attach to Amy or me or ET and basically enter the cell and then uses the host cell or the human or your dog or cats or plants, uses their own cells to actually reproduce the virus. And so it's a really sneaky organism. And then real quickly, the last two types of germs we wanted to briefly discuss are
Mushrooms.
yuck, mushrooms.
Yeah,
So-
mushrooms. I love mushrooms.
So yeah, when we think of fungus, we typically think of molds or yeast. And the most common example I can think of is probably your stinky older brothers who develop that red rash on their feet after they've been doing a lot of exercising. And we call that athlete's foot. And that's a type of fungus.
And then their last germ is protozoan.
The last germ is a protozoan.
Mm-hmm.
Well, real quickly on fungi. Fungi consist of multiple cells.
Okay.
So that's the difference. And then our last is a protozoan. And these are single cell organisms, so they only have one cell. And they typically live in wet or moist environments. And the difference between a protozoan and a bacteria are the types of basically mechanisms that they have inside of the cell. But they typically don't cause a lot of bad diseases in humans, so we're not going to spend too much time talking about that. So really, we want to get back to the focus of what we're talking about today and with the coronavirus and the fact that we have viruses and bacteria that cause the majority of illnesses in humans. And so we want to really focus on what we can do about that today. So interestingly enough, the first virus was discovered way back in 1898 by a gentleman named Marcus Bajirnik. No, I didn't sneeze, Amy. That's his last name. Yeah.
Oh, okay.
I think it's Bajirnik. Yeah.
Okay.
So he was actually a Dutch scientist who was looking at a plant and noticed that the plant was discolored, and he was able to isolate the virus, and it was actually called the tobacco mosaic virus, and it was big enough. It was big enough where he could see it under the microscope. And so basically what he did was virology, or the study of viruses. And if you study viruses, what do you call
A virologist.
them? A virologist. Yeah. And we really came about all this by what you guys have been doing in your science fair projects, by something called scientific methodology, which is very important to medicine and science in general, where we go out and we observe things that happen in the natural world. We make these observations, we may measure certain things, we come up with experiments, and we create what we call a hypothesis. And then we repeat the experiments and we may modify them, and we see if we can either prove the hypothesis true or we can disprove the hypothesis. And by doing that, we call that the scientific method. And it's super, super important in medicine and science because that's what validates a lot of our theories. And once you can repeat a hypothesis multiple times, it becomes a theory. And that's really, really good evidence in medicine. Once something becomes a theory, it's pretty certain that it's true. And so we're going to talk to you today really about the coronavirus. And there's actually multiple types of coronaviruses. There's around 7 that I know of. And the first coronavirus
was discovered in 1963
yeah,
by a woman
yes,
named June Alameda.
right.
And did you know she actually left school at age 16? She didn't have a lot of formal education early on, and her dad was a bus driver. But through her life, she ended up getting more and more education and then ended up getting a doctorate.
No, it's super cool.
And the other interesting thing, Dr. June Alameda, is that when she first presented her research on coronaviruses, other researchers discounted them and said that they were just bad pictures of influenza viruses.
So I think, ET, you may have a picture for us of June.
Okay.
So this is the picture of June sitting at her microscope. And it's actually a super powerful microscope called an electron microscope or electron microscopy. And then I think, ET, you also have a picture of what she actually saw for the first time under the microscope, which is super, super cool. And it kind of gives us an idea of why they called it the coronavirus.
There's a halo around the virus itself, or the cell, that looks like a crown.
Right. And so that's how they came to name it the coronavirus. So we kind of want to, let's first, before we get too far into viruses, let's just talk about what's in the name of what we're facing today, or COVID-19, or the coronavirus. But the infection is called COVID-19, and that really stems from COVID means corona, the vid is virus, and it was discovered in the year 2019. So that's why we call it COVID-19. The scientific name of the virus is SARS-CoV-2, and SARS stands for severe acute respiratory syndrome, and then the CoV is coronavirus, and number 2, because this is really the second type of the SARS coronavirus that we've encountered. So that's kind of why we break that out. And now we've got a really cool video of what or how a virus affects you and enters your body.
Look at this scene. It's like an alien landscape, but it's not another planet. This is a scene inside your body, inside of your lungs. The flying dot is a germ. This germ is called a virus. Viruses cause disease. They cause common diseases like colds. Some viruses cause deadly diseases. This virus is looking for a cell. The pink surface is the top of a lung cell. It is huge compared with the virus. The virus needs to unlock the cell. If it does, the virus can infect the cell. Touchdown. Now the infection can start. See the virus connect with the cell. The yellow blobs are molecules. They are the right size and shape. so they can unlock the cell. The cell surface has receptors. These are also molecules. The virus uses these to unlock the cell. In this way, the virus tricks the cell. The cell will now let the virus inside. The virus enters the cell. You can see it sink inside. This is how the virus starts to infect the cell.
Well, so that was super cool, wasn't it?
Yeah, that was so neat.
It's crazy. So once that virus attaches to the surface of a cell, you can see how it enters enters the cell. And now we're going to show you kind of what happens once the viral particle enters the cell.
Every cell in your body is like a tiny factory. All cells are making proteins non-stop. What controls the factory? A molecule called DNA. This DNA is your genetic code. It directs every activity of the cell. Other molecules read the DNA to make proteins. And even more molecules make sure the proteins go where they're needed. Viruses also have their own genetic code. But unlike cells, they can't make proteins. Instead, they take over the machinery of your cells. A virus must start by entering the cell. The virus uses the keys on the cell's surface to enter. Inside the cell, the virus releases its own genetic code. Now, it can take over the protein-making machinery. The cell becomes an assembly line for new virus particles. The cell no longer serves your body. Now, it serves the virus. The cell makes thousands of new virus particles. The new virus particles emerge from the cell. Each one goes on to take over more cells. Thousands and thousands more.
So that's a really cool example of what a virus does to the human body. And so you can see the difference between maybe how a virus affects the human body and maybe what happens. Well, maybe you can't see, but I want to talk to you quickly about, because we're running out of time, the treatment of a virus versus bacteria. When somebody's sick from a bacteria, we've got a medicine called antibiotic for that. And that usually can get rid of the bacteria and clear that infection up. But you can see that when there's a cell like that, it can be really hard to get rid of because it uses the human body's own mechanism to produce other viral particles. And so we don't really have many defenses against a lot of virus infections currently. So I just wanted to briefly touch on when the 1 second here where somebody
We're actually our clinic is still open and we're getting supplies out. So hold on a second. Live video. So there we go. No worries.
Yep. Sorry about that. So when a virus or an illness breaks out, it initially is called an outbreak, where when you're at school, there may be an outbreak of strep throat or influenza. When it's higher numbers than what we usually would expect for strep, it's usually in flu, it's usually in the winter. But if that infection spreads throughout the community and even the region, we call it an epidemic, where it's more than just localized, but it has spread to throughout the community and the region. And if it spreads beyond borders to countries, we call that a pandemic. And that's what the coronavirus is right now. And an easy way to remember the difference between epidemic and pandemic is, for a pandemic, you need a passport. So that's how I remember the difference. So that's kind of a cool way. And what we're facing right now with the coronavirus is a pandemic.
I wish I could use my passport right now.
Me too. So we really want to just briefly discuss kind of how we protect ourselves against the virus. And the best way is to use good hygiene.
Wash your hands, and especially with soap and water, because soap is able to actually get the germs off of your hands, and the water helps wash it down the sink.
Right. And if we have time, we'll do a quick demonstration of that. And then for healthcare workers, we use PPE, or personal protective equipment, to keep us safe. And Amy's going to demonstrate that here shortly, of what that looks like.
Yeah. And for all of you kids at home, I think you've been doing a good job protecting yourself against the virus, because you're staying more than 6 feet away from other people. And some of you might be wearing the surgical masks when you go to the grocery store, if you have to go somewhere at all. You're not in school right now. You're washing your hands. And so these are all ways that we protect ourselves and we protect other people. And even when you are in school, if you have a fever or you've thrown up, you stay home.
Correct.
But every time we see, as a healthcare provider, we see a patient, we have to put on our protective equipment, because we have no choice but to be in really close contact with the patient.
Yeah.
And so we have to make sure that we're protected, so the viruses don't get into our respiratory tract and make us sick. And I wanted to show you what's involved with that, because it takes several minutes, or at least it feels like several minutes, every time we put on the equipment. So I'm just going to go back here.
And while Amy's getting ready, I'm just going to basically, ET, can you, oh, Amy's going to talk about it.
So first off, I have my shoe covers on already. And then I'm going to put on my hair cover, so that if somebody coughs or sneezes, they don't cough into my hair and then I accidentally touch my hair and then touch my mouth later. And then next I put on a disposable gown. And we're supposed to change this equipment between patients. Every time we see a different patient, we don't want to spread one patient's germs to the other patient. So we have to have new protective equipment each time. Now, with the coronavirus, we've had a shortage of this protective equipment. So lots of workers have to wear the same protective equipment their whole shift. And some workers don't have protective equipment at all. And they're at a really high risk of getting sick because of it. So next, I'm going to put on my gloves. So I wear this so that the virus doesn't get on my clothes. And then I wear my gloves so that the virus doesn't get on my hands. And then I'm going to put on what's called an N95 mask. This is a special mask that the YTCC has been also helping make, these N95 masks, and other manufacturers. And these are just so precious to us, because this really helps keep the bacteria, the viruses out. And so you put on your mask like this. You have to be specially fitted for the mask. And because we have such a shortage of the N95 mask, that lots of times we'll put a surgical mask over the N95 mask so we can keep the N95 mask as protected as possible. Now, if I do anything to a patient, oh, and then lastly, I put on my glasses or my face shield, and I should have put a face shield on because people have been making us those. So if I do anything to a patient, say I listen to Dr. Surdam here, and he's my patient, and I listen to him with my stethoscope, and I've touched my stethoscope to him. When I'm done, I'm going to sanitize anything that touches him and decontaminate all of my things. And then I have to take all of this off in a very special way as well. So it's a kind of a big task to stay protected.
It is, but it's super important. And one of the ways viruses and bacteria get into our system is either through our mouth or through our nose, or even can they get in our eyes. And it's a really cool fact that on average, do you know how many times we touch our face?
So many, I can't even stop touching my face.
Like once every 2 minutes. And so, you know, if you touch a dirty doorknob or a countertop and then you touch your face, that's the most common way for the viruses and bacteria to infect us. Now, it's also important to notice about Amy's mask. Can you take off so this outer one is called a surgical mask. And really the whole point of that is just to stop the spread of droplets. So if somebody coughs or sneezes or even breathing, and they're sick, it does two things. It decreases the amount of spread of the virus, and so it keeps people safe. So it keeps, basically, if you're sick, it keeps it from spreading as far. But if you're healthy, it prevents the chances that you may breathe this in. Now, this mask that she's wearing is called an N95, and the reason it's called an N95 is that it filters 95% of the airborne particles. So 95% of the time, it's filtering out any bacteria or viruses that may be floating in the air. And so that's why it's super important, if you're going to have close contact with somebody that's sick, that we wear these. And then lastly, let's just talk about hand washing really quickly. ET, do we have time? Okay. So hand washing is super important, and I'm sure you guys have heard a ton about it, but the recommendation is to wash your hands for at least 20 seconds. And so in your head, when you're doing that, you want to probably sing happy birthday to yourself 2 times. So that takes about 20 seconds, or come up with another fun tune that you can sing. But Amy's going to turn the camera, and I'm going to just wash my hands really quickly for you guys. So you want to just get your hands wet first, and then turn the water off, and then use some soap, and then just start rubbing your hands together and really lathering them up. And Amy can sing happy birthday to me or happy Cinco de Mayo.
Oh, I don't think you guys want me singing.
Oh yeah, no, that we're good. Okay. I'm gonna sing it in my head. So you can see I'm really lathering it up. You want to rub in between your fingers. You want to make sure you get the back of your hands really well. And don't forget about that thumb. People always forget about that darn thumb, but you want to get that thumb. And then also you want to get underneath your fingernails. So make sure you scrub your fingers really well, and just like that. And that's about 20 seconds. And then you want to turn it back on and use that running water to wash away any bacteria or viruses that may be on them. And that's really the most effective way to keep your hands clean.
And then shut it off with a paper towel.
Amy said you can take a paper towel to turn it off, but I don't think that that's such a huge deal, because the chances that you're going to get an infection from that is pretty small, and we don't want to waste paper towels. So then you want to dry your hands with a paper towel or a blow dryer if it's available in the restrooms. And that's really a good way to wash your hands.
And I think that's all we have.
Go ahead, Sam.
I think that's all we have for you guys today. Thursday, I think we're going to talk about antibodies.
Yeah, we're going to basically talk about, if you do get an illness, if you do get an infection, how does your body fight the infection? And what we do here at Stitches, and what they can do at medical clinics to test for the infection. And then once your body gets an infection, and we'll touch a little bit more on the difference between treatments between bacteria and viruses.
And I think I'm going to draw your blood.
She's going to poke me, so that might be kind of cool.
So if anyone's queasy, don't tune in.
Yeah.
If anyone's really sick.
Now we'll tell you to cover your eyes.
Thank you very much for having us.
Yeah, it's been a pleasure.
All right. Well, I hope you guys enjoyed Science Week Part 1 with Amy and Dan. We learned about viruses and bacteria. We learned about a bunch of different definitions. We learned how to wash our hands. We learned what PPE material is and how it's applied, and how we can be safe when we're out there. So I want to definitely give a huge shout out to Amy and Dan for taking their time. And again, like they mentioned, we're going to be back Thursday, 6 p.m. for Part 2 of Science Week, where Amy and Dan will continue to talk about what this virus is, what is an antibody, and how we actually test for viruses. So it should be a really exciting wrap up to Science Week. And I also want to give a special shout out. Those videos are super cool. So if you like those 2 videos that we talked about, that is from the Vaccine Makers. They are a nonprofit organization. You can go to vaccinemakers.org, and they have more videos and more lessons and tutorials. So check them out. We asked for permission to use those videos. They were very generous in saying yes. So again, you can see just great stuff. So if you want to learn more about viruses and bacteria and watch those kind of videos, vaccinemakers.org. So, and once again, and then the images that you saw were from Getty Images, so there will be links in the comments below if you want to look at those. And just want to thank all of you again for tuning in for WYSTEM. It is Science Week, and we will be back with you live Thursday at 6 p.m. for Science Week Part 2. And then we will have some time on Thursday to get you some questions and answers for Dr. Dan and Amy Surdam. So it should be a really great first week here for WYSTEM. So hope you all stay healthy and well, wash your hands, and we'll see you back here Thursday night. So, all right, everyone, have a good evening, ET, and I'll see you here in a couple days. Bye.